Good afternoon, everybody. This is Marilyn Francis from the Patient-Centered Primary Care Collaborative. Thank you so much for joining us for this, what promises to be a very exciting webinar we're having today. It's about patient and family panels, inspiring and energizing staff. And I just wanted to do a little housekeeping before we start and have our speakers begin. First of all, before we begin, just want to make sure that you understand that there should be handouts on the side, and you can click on those on the pane to download the slides and the additional resource materials. Also, if you have questions under that list, you'll see that you could click on the questions and type your question in, and we'll be doing a Q&A at the end of the session. Also, if you want to speak, you can raise your hand, and when we have our conversations, we'll have you unmuted. And then also you can adjust the size of the speaker panel and the slideshow to your convenience. And then after the webinar, I just wanted to let you know that please complete the post-webinar survey. Your feedback will be greatly appreciated. And also we'll be sending you a recording of the slideshow, as well as we will be sending you the additional materials. You can also download these at the PCPCC website /webinars. And so before we move on, I just wanted to tell people a little bit about the Patient-Centered Primary Care Collaborative. We have a mission to promote collaborative approaches in primary care for improvement around patient-centered care, patient-family engagement, patient activation, and improved cost, quality, and experience outcomes. And you'll see on the right side of the slide some of the resources that we have on our website. And also we're a participant in the Transforming Clinical Practice Initiative, which is a CMS initiative, and we're a support and alignment network. And so as a result, we are very, very proud to be able to support this webinar that you're going to see. And so let me introduce you to our presenters today, Beth Johnson and Deborah Dawkins. So Beth, you want to take over?
Sure. Thank you, Marilyn. And it's just a delight to work with you and PCPCC. The Institute for Patient and Family-Centered Care has been really pleased over these last almost 4 years now to be a subcontractor to the important work of the SAN, the PCPCC SAN, in the Transforming Clinical Practice Initiative. I'm the president and CEO of the Institute, and I'm pleased that Deborah Dawkins, a family leader and IPFCC's coordinator for patient and family partnerships, is joining us today. You may not have met Deborah, but you've probably read some of her stories. She has been describing some of the exciting work in stories that are happening in the TCPI initiative, particularly related to partnering with patients and families and practice transformation. And you'll get to hear more from Deborah in a few minutes. So today we're going to talk about patient and family panels as a way to really inspire and energize staff and clinicians, but also as a way to learn about the experience of care, how patients and families see the experience, what works for them, and what makes it a little harder for them. And that can be so helpful as you work further and continue to do this important transformational work that you've all been doing over the last few years. We're going to talk about the best practices for facilitating a patient and family panel. Deborah's going to give you lots of practical tips about identifying panelists and preparing and supporting them. I'm going to talk a little bit more about how to prepare leaders, clinicians, and staff to learn from patient and family panels. And then we'll talk a little bit about other ways to share stories for improvement. We want to say up front, this is not rocket science. This is, it's not that hard to do. It doesn't take that much time, but there are practical tips that can just assure that you can be successful and find this a very powerful way to learn from patients and families. And we like to anchor all of our work in these core concepts of patient and family-centered care. And thinking about your ambulatory practices, are you explicit that these are important ways that you treat everyone, patients, families, and healthcare professionals, that everyone is treated with respect and dignity, seeing strengths in all people, and then that you share useful information with patients and families in ways that they find it affirming and practical in their lives. The third core concept of patient and family-centered care is that you encourage and support their participation in care planning, and decision-making. You know, it was really a very strong goal in TCPI about shared decision-making. So again, you can use the panels to learn about how well you're doing in encouraging and supporting patients and families in shared decision-making. And lastly, collaboration. That's at the heart of all of this work that we've been doing in transformation. It's collaboration in the clinical encounter, but it's also collaboration in your quality improvement work and any efforts that you have to orient new people that are joining the ambulatory practice, even in research that you can partner with the patients and families you serve. A short definition that captures the spirit of these core concepts is that patient and family-centered care is working with patients and families rather than just doing to and for them. It's so important that they are part of the process, and so that they engage and they can manage care between visits to your clinic. So one of the things you might do in preparation for doing a panel, this is a very short article that appeared now almost 10 years ago in the BMJ. And it's written by key leaders in healthcare. You all know Lucian Leap as the father of patient safety, Don Berwick. Carolyn Clancy used to head the physician head of the Agency for Healthcare Research and Quality. And Jim Conway was just a wonderful healthcare administrator. And this is a very short article, and this part about partnering with patients and families is even shorter, so you could take it to a staff meeting or to your with your medical group. And what it's saying is it's really key in 21st century healthcare that organizations publicly and consistently affirm the centrality of patient and family-centered care. So perhaps those four core concepts would appear in your waiting room, or they might appear on your website or in exam rooms. And when you do that, it reminds both staff and patients and families how you're working together. Marilyn showed these wonderful shared principles of primary care that were developed very collaboratively with lots of physician groups and national and local organizations to really articulate what are the key shared principles. And these are topics that you might want to explore further in a patient and family panel. You know, what does it mean to have care that is continuous? Or what does it mean to be team-based and collaborative from the perspective of patients and families? So I think those shared principles can be used in lots of different ways. So here is a panel, and it doesn't always have to be this large a panel at all. But this was a particularly wonderful panel that we had facilitated. You see Liz, our colleague from Canada, facilitating the panel on the right in a red top. And the panel reflects diversity, different points of view, and you can see the patient on the left so engaged with the audience. So what we think of as a patient and family panel is an opportunity to learn directly from patients and families about the experience of care within an ambulatory practice, but I think across all settings of healthcare, and particularly to learn about transitions of care, which we know are so important to safety, quality, cost efficiency, and the patient experience. And I think that we know as healthcare professionals what we do, and we think we have it right in terms of how we communicate with patients and families. But to hear directly from them, it can be both inspiring but also informational and educational. We have facilitated at IPFCC hundreds and hundreds of panels. Deborah has, I have, our other staff and colleagues, and they always leave people. Sometimes the staff are concerned, oh, I'm just going to be overwhelmed because they want us to do more. That's not what they're asking. They already know you're overwhelmed, and what they can help you see is what are the most important things? How can I do this a little bit better? So we really think it's a very important strategy to use as you work on transformation. I think it helps shape, and when you introduce the panel to your colleagues, it helps reinforce and shape our view that patients and families are really the experts on the patient experience. And they bring different perspectives. It's not saying your perspective isn't important at all, but they bring a different perspective that can be very humbling, and very often they're just inspiring. I will say, and I bet Deborah says this later as well, I always need Kleenex in my pocket because often these panels just touch a chord, whether it brings back a memory for me personally or just how touched I am by their eloquence and the way they frame issues in a way that we can all learn from. It also provides a panel, gives you an opportunity to see the interactions among patients and families that you don't see in your waiting rooms or in your exam room. And that in itself gives you a different view, because these patients and families don't live in isolation. And so that's an important benefit of the panel. And then what we think is particularly important is after you've facilitated and introduced the panel, there's an opportunity to explore and ask questions. And this is the dialogue with your staff and clinicians and patients and families. Again, another shared learning experience. Karen was a wonderful panelist, and I know how important care coordination is, and she helped us see it from a slightly different perspective. And what she valued so much, it really was tailored to her particular needs and priorities. And it was within and across all the different care teams that were working with her that was really made it meaningful. Another panelist, she was great in talking about her large Latino family when she suddenly needed lots of care, and talked about the feeling that so important that her family and friends were an important part of her team, and helped her know she shouldn't give up. So again, thinking about your practice, how do you encourage that in the ambulatory practice? And then she did help us, and this is one way we frame questions, is what would have been more helpful to you? And not saying a negative thing. And she wanted people to talk more with her instead of about her or around her. Another panelist is a mom who has a daughter with very complex healthcare needs. And again, it was how the staff and clinicians taught her to be an advocate and a true partner in her child's care. And what was really helpful to her was it helped to have everyone say, we're going to learn together about how to deal with this rare and complex condition. And there were so many practical things that they taught her so she could be a meaningful partner. And then Barry was wonderful, again, talking about how he had a rare form of cancer, and it was that people conveyed uncertainty in an honest way. Again, helping to help him come to grips with the complex condition that he had. So I'm now going to turn it over to Deborah, and she has this wonderful experience broadly in facilitating successful panels.
Thanks, Bev. Just to quickly summarize, patient family panels can be a really excellent way to give voice to patients and families and to utilize the expertise of their lived experience with healthcare. And speaking of experience, I just wanted to explain quickly my own experience. As Bev mentioned, I'm a longtime family leader, now a staff member at IPFCC. And in that capacity, I have been a panel member myself several times. But I was also the associate director of a project called the Initiative for Pediatric Palliative Care, which was a 12-year national project focused on education and quality improvement. And in the project, we developed a 25-hour curriculum and then took that curriculum and did 21 educational retreats across the country. And every one of the retreats included family members as full participants. And each retreat also had a family member panel. And I had the honor of moderating those panels. So in the next few slides that I'm going to share with you, I'm going to combine that experience with IPFCC's years of work with partnering with patients and families so that we can share some key steps or best practices with you about planning for panels, planning and conducting them. So we're going to talk about 5 steps: identifying and selecting panelists, thinking about the moderator, who's going to moderate that panel and what is that role? How do you prepare panelists after you select them? And then how do you support them during the panel itself? And maybe most importantly, how do you follow up and maintain your contact and collaboration with them? In terms of identifying patients and families to be panelists, we think it's helpful if you develop your own list of characteristics of what would you be looking for in candidates. We'd suggest some things like thinking of people who are now at a point where they are really managing their own healthcare experience. And by that, I don't mean that they're managing their condition, but they sort of understand their healthcare experience in a slightly broader context and can draw some learnings from that. Also, people who are invested in helping other patients and families and in giving back in some way. And it's always helpful that people have had some experience with doing presentations. I think that clinicians and healthcare professionals are the best starting source for identifying patient and family panel members. And I always say to people, just kind of close your eyes and what patients and families come to mind, and that's a good starting place. As Bev mentioned before, it's important to try to achieve some variety and balance in the panelists. So different ages, different conditions. And you don't have to find your panelists all on your own. You can turn to community resources. For instance, some of the disease-specific groups like the American Diabetes Association that would have a local chapter. And then the last thing I really want to emphasize, after you've identified some patients and families and reach out to them and ask them if they would want to be a panelist, really, really rely on their self-selection. They know when they're ready to participate as educators. And I always like to share a small story from a time when I was asking a woman about being a panelist, and she was very articulate. She was a school administrator, and I asked her to be a panel member, and she said to me, "I would love to do it, but could you please call me back in 3 years?" The specificity of her telling me exactly when she thought she would be ready. So I rely on patients and families to tell you if this is a good fit for them at the time. After you've identified them, then of course there needs to be some preparation, explaining the goals of the panel. And if the panel is part of a broader educational event, like say a day-long seminar or something, how does the panel fit with the broader goals? Bev mentioned this before, but I want to mention it again to emphasize to the panelists that as patients and families, they bring unique expertise. And I emphasize this because they may not always have heard this before, especially in the context of providing education to healthcare professionals. Of course, you would share key questions that will be guiding the panel, and we'll talk about a handout in a minute. And also explain how the panel will be moderated, who's doing it, kind of what the flow will be. I think it's also very important to talk to the panelists about the audience. Who's out there in the audience? Are they very experienced healthcare professionals? Are there students? Are they a mixture of specialties? And what that might mean in terms of what the audience is interested in. And last but not least, because it seems so obvious, but don't neglect to outline the nuts and bolts. Something as small as what they should wear, will they be reimbursed for expenses, things like that. I said I would share, so in your handout, the first two are materials that you might want to share with panelists to really help them organize their stories. The first one is in narrative form, talking about panels a little bit about patient and family-centered care. But the second one that is here on the slide is an actual worksheet that the panelists could jot down notes in order to organize their own thoughts and stories. And in this case, the format is driven by the two questions of what worked really well for you, and then contrasting what could have been done better. But of course, you could choose other questions depending on the purpose of your panel. So we've talked quickly, but we've talked about the role of the panelist. But the moderator is an equally important part of having a successful panel. The moderator often is the one who prepares the panelists, hopefully being able to even reach out to them ahead of time by telephone, sharing a handout like the one we just looked at. And then at the actual session, the moderator is the one who introduces the session and sets the stage for how the panel is going to promote learning. And also, I think the moderator at this point is the one who also kind of circumscribes the purpose of the panel, that it's not about everything, and that there are certain goals and objectives for the panel as there are for other learning sessions. The moderator, of course, guides the flow of the session, would often call upon panelists and suggest the order in which they would speak. And then Bev talked about this before. The moderator, and this is something I think we often don't think about, really is the one who helps everyone in the room, the panelists and the audience, respect emotional moments that the panel members might have. Not uncommon that a panel member may be brought to tears by what they say themselves or by what someone else says. And there may be people in the audience too, and the moderator helps make that okay, because it is okay. The moderator, of course, fields and clarifies questions from the audience. And then maybe one of the hardest parts of the role of the moderator is managing time, especially if panelists, one or two of them are a little more talkative than other ones. And I have a hint about that on the next slide. So based on my own experience as a moderator, I just wanted to pull together a few hints or tips. One is, in addition to having a few key questions like what was helpful to you and what was not so helpful, another option is to have some kind of prompt for panelists to react to, like a very short video clip that they watch together with the audience, or a short case, and then each panel member can comment. So that's one slightly different way than questions. I think it's beneficial, if it's at all possible, to have panelists meet one another together with the moderator a short time before the session. And then the moderator ahead of time can really be so helpful in setting respectful limits about the length of panel member responses. For instance, saying ahead of time, each of you is going to give a very short introduction about your experience. I often would say like just 3 or 4 sentences, because there'll be plenty of time later to expand on that, but to do that up front so everyone is on the same page. Although we recommend having key questions prepared, you can later on in the panel let panelists actually interact with one another to respond to something that one of their panel colleagues has said, so that there's truly a discussion. And finally, I think it's a good idea to establish boundaries with the audience right before the Q&A session, that a panelist has the right to say, no, I don't feel comfortable responding to that question, and doing it ahead of time mitigates awkwardness at the moment that it comes up. So I just wanted to, back to the Kleenex and the emotion. This is a quote from an actual family member panelist who says, yes, we might be emotional, but we've decided that the benefit of being an educator outweighs the burden. So giving us permission to empathize with their emotion, but not to feel bad that it was elicited. The last sort of sequence is, it's really, really important to do follow-up after the panel, to communicate with the panel members, saying thank you, obviously, but asking them if they have comments about the next time we do a panel. Are there ways that we might make this better? If you've done evaluations, to share the summarized results with them. And then, very important, to encourage your practice leaders to begin a discussion about possible roles, to continue collaborating with these patients and families in future initiatives. And we have just a couple examples that are very current to share with you. So you might have a panel about pain medication and substance use disorder, and hear the perspectives of people with lived experience. But how wonderful then if there is some kind of work group or task force that some of the panelists could be included in that group. And another example, some of you might be working on implementing open notes. And again, that same sequence could occur where you hear from the patients and family members on the panel, but then can carry through with collaborating with them. And I want to share one more closing quote, again from a family member. We need to know that our participation had a purpose and will make a difference. So find in any and every way possible to be able to demonstrate that you are using their input, because it came from a really important place for them to share that input, and to really demonstrate that you hope you can collaborate with them in the future. So we've talked about panelists, and now Bev's going to talk a little bit about preparing clinicians and staff, and some more about using patient and family stories.
Thanks, Deborah. And, I think that it's always helpful to introduce the concept of panels ahead of time, with following how Deborah so thoughtfully described selecting and preparing panelists, sometimes the fear from staff, clinicians, and leaders is they're going to share their anger, they're going to share emotions that we all can't handle together. They may have lots of fears, and I think it's important just to elucidate what are your concerns, what are your fears. But we found it very helpful to take those 4 core concepts of patient and family-centered care: respect and dignity, information sharing, participation, and collaboration, and say, we're really developing our understanding and commitment to those ways to provide health care. If we're going to provide high-value health care in the future of ambulatory care, we've got to anchor this work in those 4 principles. So you can talk about, that they do bring this unique and different experience, really about their lived experience. And they help you see, because you see them probably in the clinic, but you don't see them across settings. And they bring that continuity of experience that can be really helpful to you. But I think that it's just very helpful at all stages in preparing staff and clinicians about what concerns they might have, so you can anticipate it and say how we will talk about it, because this should be a positive learning experience for everyone. Sometimes we found it helpful that there's someone else in the practice, particularly small practices, that you've prepared ahead of time also, and they can be a co-champion with you to just make sure people are comfortable talking about it, because it is a different way of learning from patients and families. And then there are lots of examples on our website and in other resources that will talk about how to partner with patients and families in orientation and quality improvement work, and in really the education of healthcare professionals, students, and trainees. Another resource that you might want to look at, and you could just go to this particular, these pages within the wonderful book that the Institute of Medicine, now called the National Academy of Medicine, published a few years ago, Best Care at Lower Cost, The Path to Continuously Learning Healthcare in America. And if you just put the paragraph that was one of their key recommendations in a very thick book, that it really talks about patients and families should be given the opportunity to be fully engaged participants at all levels, including individual care decisions, health system learning and improvement activities, and community-based interventions to promote health. That gives further legitimacy to this important collaborative work. And another white paper that's available from IHI that you might share with clinicians ahead of time. It was a white paper that was rewritten in 2008 to include this key lever for leaders. And it basically is saying leaders of organizations that have become very successful say that putting patients and families in a position of real power and influence, using their wisdom and experience to redesign improved care systems, as being the single most powerful transformational change in their history. So again, letting people see that key as this is why we're doing this. This is going to be important to our future. Rita Sharon is an expert in narrative medicine, and she talks about, the variety of ways that we can learn from storytelling. And it helps us see with new clarity deep aspects of the illness, the sick person, the situational care, and the person who cares for the sick. I think there are a lot of ways that you could use stories of patient and family, use stories of patients and providers and staff. I think it's helpful to start a leadership meeting or a staff meeting with a short personal story. You can invite a patient in and say, we would love for you to share in just 5 minutes 5 to 7 minutes, your experience. Or maybe one of your staff or clinicians have had a recent healthcare experience that they would want to share. And again, giving guidance that it's just set the stage. And I think it's always helpful to say we're looking for stories that illustrate those 4 core concepts of respect and dignity, information sharing, participation, and collaboration. Sort of when it's there and when it's not there. Another way you could have, maybe it's you have a patient and family with a brand new diagnosis of type 1 diabetes. Well, you could talk about how you did this and what it was useful from your perspectives, and then hear from patient and families about that. So you could have it on a clinical condition, or these stories could be used as part of launching a quality improvement team. Suppose you're going to work on workflow. That's an important thing that staff care a lot about, and so do patients and families. And to think about how you would do that differently. And often if you don't have patients and families at the table or hearing their perspective, it's all planned from the perspective of staff, and they don't realize the missed opportunities for improvement. It can be when you're orienting another, brand new people to your practice, and staff and clinicians having sharing of stories. They always say it's the best part of orientation. And I think they add, when we're talking about health promotion and disease prevention, I often think about the clinician who told me that I have a very crazy travel schedule and a crazy life in some ways, and I had gotten a bicycle in my basement, and I just was finding a little bit of time to do it. And he told me, that's just a waste of time. And that stopped me from doing any meaningful exercise for quite a long time. And I always wanted to think, could I come back to that practice and said, if you just encourage me a little bit, and then said, there are other ways that you could do this as well, and make it meaningful for someone whose life is pretty busy. Kathy Dutton, a clinical leader at Vine Medical Center, said, we have learned to use stories strategically. Thousands of our team hear stories at new employee, volunteer, and physician orientation. So that was really a cornerstone of how they oriented new employees and new volunteers. We have a lot of tools that might be useful to you. We've given you 2 handouts that I think really simplify your task if you're going to be facilitating panels. And then Deborah has done some terrific work in developing various sections on our website. So there are lots of tools and interesting stories in the partnerships in interprofessional education and how you can partner with patients and families in panels and in other ways. And there here direct links to a number of resources for best practices and a bibliography. Then another section of our website is really the partnerships in ambulatory care. And that's where you will find many of the stories from the TCPI that we've worked together with PCPCC. And I think you will find them interesting and helpful to the work you're doing. And again, you can link here for more opportunities. And we have had, as part of TCPI, a terrific online, totally free learning community called pfcc.connect. And there is a separate section in it just on ambulatory care. And people really across North America and even more broadly have joined in some of the informal conversations. So you can join and then pick up and join a conversation, or you can just read some of the threads in it. But I urge you to ask some of your staff and even your patient and family advisors to join pfcc.connect. So Deborah and I are here and happy to answer questions and comments. We'd love to know, what other questions you have or ideas or even examples of what you've done in your ambulatory practice. You certainly can email us later, but we'd love to see if you could chat it in. So I think I'll turn it back to you, Lauren or Marilyn, and see if there's anybody that wants to have questions or comments.
I don't see any questions yet. Also, if you want to raise your hand, we can also unmute you and you can ask a question.
Yeah, we have a question. Melissa Matrix, can I unmute you now?
Hi, Melissa. You have a question?
Hi, how are you?
We're good.
Yeah,
Tell us
I'm so happy to follow this webinar. I work more in visual communication for patients, and I was wondering about the videos that you are showing to the patients, and if you can tell us like a little bit more about that.
Well, often if you're going to use a video as part of a panel with patients and families, often that might have been a custom-made video, or you could, maybe you might be using it as part of quality improvement. So perhaps you have a little video on, I'll use the example of diabetes, how you would teach someone about either eating or taking insulin. And as part of the quality improvement work, let's look at the video together and then have a conversation about what works and what could be changed. So it's part of quality improvement, would be one way to think about it. Maybe you're working on, the after visit summary from an ambulatory visit. And you could just with a simple iPhone, videotape the exchange of how that after visit summary is handed to patients and families. And then look at it together with staff, and that would be the registration staff and clinicians and other staff with patients and families, and say, now, does that work for you? Is that how we want everyone? So it becomes part of the standard workflow. Does that make sense to you?
Sorry, I had muted her. I can find her again.
Okay. I'm wondering if there are any other questions or comments. Anybody, have you done a panel? We'd love to hear your experience.
There is a question from Mina. Do you recommend screening self-identified panelists who might have their own agenda?
Yes, and that I definitely think you need to be thoughtful in how you select patients and families. I often say to folks, the one concern, both in serving on a committee, a quality improvement committee, or on a panel, if the individual is really angry, that's not going to be helpful. We want patient and family advisors to be able to share their stories in ways that people can learn from. And you want to hear from that person who's really angry, but giving the stage of a panel, that may not be the best environment. I think also you should find out, again, you're talking to them, if they have a particular agenda. And that, again, I think you're careful in selecting that, and you may want to say, I think there are other ways that we should hear your agenda. Mm-hmm. And Deborah's nodding here. Anything else you'd say?
Well, that was also what I was alluding to when I said one of the first things to think about in selecting panelists is patients and families who are at a certain point in managing their own healthcare situation. So they're not so raw and so in chaos, which might mean that they're angry or they're not, that we always used to talk about finding patients and families who were at the point where they could extract from their own experience some things that were, more broadly applicable to healthcare and healthcare delivery, rather than just totally being at the moment with their own, every detail of their own story.
And just to add to that and sort of take it a little different direction, we did in the early phases of the HIV/AIDS epidemic, we were asked to help build the system of care for women and children infected and affected by HIV and AIDS. And some of the most powerful panelists were people that came from underserved communities. Many of them had, very limited education, but they had the ability to communicate in effective ways about, I can think of one woman who said, I want people to know I can learn, that I want you to share with me information about my disease because I need to learn about it. And hearing that, so many people were judgmental and set up a negative experience. And it can be all walks of life, and the people we probably need to hear from the most are from those diverse and underserved communities. Are there other, going over this all in detail, it is such exciting work to do. I hope you don't feel like this is one more thing I have to do, but one thing that just a lot of people tell us when we see them traveling or at meetings, this is the best part of my practice. It gets me back to why I wanted to be in healthcare.
Not seeing any other questions. Either raise your hand or put it in the question box.
If anybody's done a panel or invited a patient or family to share their story, feel free to share us with us. Well, maybe we covered it for today. I hope we've given you lots of things to think about.
Yes. Yes, you gave a lot of information. I think you really covered all the bases. Very good. And also, don't hesitate contacting us if you do have any further questions after the presentation. But we appreciate you joining the conversation, and thank you, Bev, and thank you, Deborah, for your wonderful presentation. We really appreciate it. So, thank you.
Thank you.
Thank you.